It's time for our nursing tip of the week. And in this week's tip, I'm talking about some IV complications and how to know when your IV may be going bad. I found this nice image on the internet that gave some good pictures of some IV complications. So I thought we could use this. And then I'm also going to talk about some other little nursing things that I have learned over the years. It's really important to be constantly assessing our patients' IVs for any of these different things because an IV going bad can potentially have lifelong impacts on our patients depending on how it went bad, what was infusing, where it was infusing. So these are some things to look out for. First one is infection. Obviously, we kind of know that, right? With everything, like if it's swelling, if it's hot, red, you'll see the skin kind of getting irritated. If I saw an IV site like this, or really any of these, I would immediately take the IV out. Next thing is phlebitis, and this is where the vein is actually irritated. It could be from medications irritating the vein, or this says if the cannula is too large for the vein or improperly secured and kind of rubbing and irritating the internal part of the vein. But you'll notice kind of red streaking, and I'm going to show you a better picture here. Here's another example of phlebitis. You can see just the entire vein going up is red. Next complication is infiltration, and this is where IV fluids or medications leak around the vein into the surrounding tissues. So you'll notice that the patient starts to get pretty swollen in that area. Sometimes when you're infusing a large amount of IV fluids, let's say you're giving a liter bolus, you'll actually be able to feel the patient's skin and it'll feel cold all around the insertion site. Depending on what is actually infusing into that IV, it may be totally okay, the fluid will just reabsorb. Or if this is a harsh medication that to be in the soft tissues, something called extravasation, I can't say that word, may occur. This is where a vesicant medication is leaking into the tissues and it can get pretty yucky. That's why you hear of certain medications only being able to give through large bore IVs or essential lines because they are so irritating to the veins. Potassium, vasopressors. You'll see the area gets super red. Sometimes you see blistering. It can get really hot, swollen, irritated, yucky. Sometimes this tissue can get necrotic. This is not good. Another thing I want to say is if you look at your patient's extremities and let's say they have IVs on both sides and you notice that one side is way more swollen than the other, definitely be concerned for infiltration. Next complication is a hematoma. This is where it bruises up around the vein. Maybe the vein's blown, and so the medications aren't properly infusing into the IV. Last thing is air embolism. We talked about this in a previous video, so I'm not going to cover it right now. Anytime you see any of these things or your patient's complaining of pain, you're not getting great blood return on the IV or no blood return, it's always important to just take the IV out, replace it with a new one. It's better to be safe than sorry. And that's your tip of the week.